The world is full of people of every size, shape, and color imaginable. Mixed in with the rest of us, there are also some people with rare body features that most of us don't have. From babies born with mermaid-like legs to a guy who grew a horn out of his head, these cases baffled the whole world. And today, we'll look at 15 of the strangest body parts ever found on humans. Number 15. Fibrodysplasia ossificans, progressiva. When Ashley Kurpiel was just a toddler in Georgia, doctors believed she had cancer. At just 2 years old, they amputated her right arm and shoulder, thinking it would stop an aggressive tumor. But after some time, the heartbreaking truth came out. It wasn't cancer at all. Ashley had fibrodysplasia ossificans progressiva, or in short, FOP. It's a genetic disorder where muscles, tendons, and ligaments slowly turn into bone, as if the body is forming a second skeleton. Many patients are born with a malformed big toe, but doctors often miss it. Even small injuries or deep injections can trigger irreversible bone growth. In 2006, researchers found nearly every case is linked to a gene called ACVR1. That tiny mutation tells the body to keep forming extra bone. It affects about 1 in every 1 million people. In 2023, the FDA approved palovarotene, Sunos, a treatment that helps reduce flare-ups. Ashley continues to raise awareness, proving how overlooked signs can lead to devastating misdiagnoses and lifelong challenges. Number 14. Lithopedion. In La Boca, 92-year-old Estela Melendez was hospitalized after a fall. But during scans, doctors were astonished to find the calcified outline of a fetus inside her abdomen. This wasn't a case of fetus in fetu. It was a lithopedion, also known as a stone baby. It occurs when a fetus dies during an abdominal pregnancy, and the body encases it in calcium to protect against infection. In Estela's case, the pregnancy had gone unnoticed for over 50 years. Doctors think it explained why she never had kids. The preserved fetus weighed about 4.4 pounds. Since it wasn't causing health issues and she was in her 90s, doctors opted not to remove it. Lithopedion is among the rarest medical events, with fewer than 300 cases documented globally across 400 years. It occurs in around 1.5 to 1.8% of abdominal pregnancies. Estela's case became one of the most publicized, showing how the body sometimes defies medical expectations. Number 13. Diprosopis. Lali Singh's story became unforgettable. She was born on March 11, 2008, in Saini Sunpura near Delhi, with a single body and skull, but duplicated facial features, 2 pairs of eyes, 2 noses, and 2 mouths. Villagers briefly saw her as a reincarnation of the goddess Durga, and her parents, Sushma and Vinod Singh, took her home. Doctors diagnosed her with diprosopis, not conjoined twinning. In diprosopis, parts of the face duplicate on a single head. Scientists link it to malfunctions in the sonic hedgehog gene pathway, which usually controls midline facial development. When it goes off track, facial features may widen or replicate. It's among the rarest craniofacial disorders, with only a few dozen cases ever documented. Most don't survive birth. Lali's family declined CT and MRI scans, so doctors couldn't assess her brain or airway. Feeding was complicated by a cleft palate, and her 2 central eyes couldn't close, leading to damage. Lali lived for 2 months before dying from cardiac arrest, and Tress Johnson is another one. Number 12. Cutaneous horn. In 2019, 74-year-old farmer Shyamlal Yadav from Madhya Pradesh caught global attention when a hard, cone-shaped horn began growing from his scalp, eventually reaching around 4 inches. For years, his barber simply trimmed it. But once growth accelerated, he sought help at Bagyode Tirth Hospital. Imaging verified it hadn't penetrated the skull, so surgeons removed it cleanly and sent the base for analysis. This bizarre growth is known as a cutaneous horn. It forms when keratin, the same protein found in hair and nails, accumulates into a dense spike on the skin. These often form on sun-exposed areas like the scalp, ears, and hands, particularly in older adults. The horn itself isn't the concern. It's the skin beneath it. Studies show up to 20% conceal cancer, another 23% grow from precancerous lesions, while the rest are benign. That's why doctors always test the base. If benign, removal is enough. But if cancer is found, wider surgery is needed. Number 11. Parasitic twin. Baby Dominique was born in Côte d'Ivoire with a condition doctors rarely encounter: the partially developed remains of a twin fused to her upper back and neck. Attached to her body were 2 legs, a pelvis and bladder, a second spine entwined with her own, and even tiny toenails. At 10 months old, she was flown to Chicago for advanced medical care. A team at Advocate Children's Hospital used MRI, MRA, CT, a CT pyelogram, and full 3D modeling to examine every detail. On March 8, 2017, 5 surgeons spent 6 hours carefully separating her from the parasitic twin. Since Dominique's own heart and lungs were supporting both bodies, precise imaging and planning were essential. Incredibly, she was discharged just 5 days later. During recovery, she stayed with a host family coordinated by Children's Medical Mission West. Parasitic twins occur in about 1 in 1 million births. Dominique's case became a landmark success, proving survival depends on whether vital organs or structures are shared. Number 10. Fetus in fetu. Sanju Bhagat is a farmer in Nagpur, India, who experienced a life-changing moment in June 1999. He'd been struggling to breathe. His abdomen was enlarged, and doctors suspected a massive tumor. But during surgery, what they found shocked everyone. Inside were limbs, hair, and even fingernails. It wasn't a tumor at all. It was the remains of his own twin. This condition is called fetus in fetu. Unlike cancer, it has identifiable body parts like a spine or limbs, showing it once attempted to develop as a sibling. It's extremely rare, occurring in roughly 1 out of every 500,000 births. Even more unusual is that it remained undetected until adulthood. After the malformed twin was surgically removed, Sanju made a full recovery and returned to his daily life. His case drew global attention and remains one of the rarest ever documented. Doctors emphasize the importance of imaging to distinguish it from tumors due to its embryonic origin and visual similarity to teratomas. And I don't know why, but people call him Pregnant Papa. Number 9. Coloboma. Stephen Nederick lives with a rare eye condition called coloboma. Because part of his iris never fully developed, bright light is overwhelming for him. Outdoors, he wears tinted glasses to reduce glare, but when competing, he relies entirely on rhythm and muscle memory. Coloboma is rare, found in 1 to 2 cases per 10,000 births. It's immediately visible because the pupil appears keyhole-shaped rather than round. It happens when, during early development, the eye fails to fully close along the fetal fissure. Depending on the location, iris, retina, or optic nerve, vision may range from normal to significantly impaired. People often experience light sensitivity, glare, or long-term risks like retinal detachment. Treatment varies. Some benefit from tinted lenses, others use assistive vision tools, and surgery may help shape the pupil. While rare, the condition doesn't always limit potential. Nederick's story proves that even with a visible difference, focus, discipline, and physical ability can still reach world-class levels. Number 8. Progeria. Sam Burns became the face of a rare condition he handled with resilience far beyond his years. He was born with progeria, a genetic disorder that accelerates aging in children. The cause is a mutation in the LMNA gene, which produces a toxic protein called progerin. It's not about wrinkles. It's about arteries aging too fast, often leading to fatal heart attacks or strokes in adolescence. Progeria is extremely rare, with roughly 1 in every 4 million births affected and fewer than 400 known cases worldwide. Sam shared his life philosophy in a TEDx talk titled "My Philosophy for a Happy Life," touching millions. He passed away at age 17 in January 2014. His parents co-founded the Progeria Research Foundation, which played a key role in advancing treatment. In 2020, the FDA approved Zokinvy, the first drug shown to improve lifespan and artery flexibility in children with progeria. It's not a cure, but it changes everything. Number 7. Harlequin ichthyosis. Nusrit Nellie Shaheen from Coventry, UK, has lived her entire life with harlequin ichthyosis, a condition so uncommon that most doctors will never see a case. She's widely recognized as the UK's longest surviving individual with it, and often shares how consistent care and family support have helped her manage. Babies with this condition are born encased in thick, diamond-shaped skin plates that crack, leak fluid, and sometimes pull the eyelids and lips outward. That's why newborns require immediate intensive care. The disorder results from mutations in the ABCA12 gene, which is crucial for skin barrier function. Without it, the skin fails to retain moisture or block infection. Harlequin ichthyosis affects about 1 in 300,000 births. Ongoing care involves keeping the skin soft with moisturizers, humidifiers, and careful eye and hand protection. Some infants are treated with oral retinoids, while others improve with specialized neonatal support. Survival rates have improved in recent years thanks to advances in children's hospital protocols and therapies. Number 6. Macroglossia. Paisley Morrison Johnson gained nationwide attention when her tongue grew more than twice the size of her mouth, making it nearly impossible to breathe or feed. She was diagnosed with macroglossia, a condition where the tongue is significantly larger than the oral cavity. She was transferred 200 miles to Sanford Children's Hospital in Sioux Falls, where a father and son surgical team began her treatment. Before reaching 16 months, she underwent 2 tongue reduction surgeries. For the first time, she could close her mouth, eat, and smile comfortably. Macroglossia can be either absolute, when tongue tissue itself is enlarged, or relative, when a tiny jaw makes the tongue appear too big. One common genetic cause is Beckwith-Wiedemann syndrome, a growth disorder where a large tongue is a signature feature. Babies are closely monitored for low blood sugar and tumor risk. Tongue reduction helps improve speech and life. Number 5. Hypertrichosis. Supatra, Natty. Sasophon from Thailand first made headlines in 2011 when Guinness World Records named her the hairiest child alive. She never sought the spotlight, but her appearance made headlines worldwide. Natty was born with hypertrichosis, also known as Ambrus syndrome, an exceptionally rare genetic condition. Fewer than 50 cases have ever been documented globally. The condition causes fine, dense hair to grow in places it usually doesn't, such as the cheeks, forehead, ears, and shoulders, while leaving the palms and soles unaffected. Hypertrichosis is entirely separate from hormonal hair growth. It's often present from birth and isn't tied to hormonal imbalances. In Natty's case, the follicles grow soft, lanugo-like hair continuously. Treatment like laser removal usually fails due to the hair's nature. Despite public reactions, Natty embraced her condition with confidence, attended school, and lived a full social life. Her story helped challenge beauty norms, and she is definitely beautiful. Number 4. Situs inversus. Rosemarie Bentley of Malala lived to 99 without knowing she had one of the rarest anatomical conditions, situs inversus, with levocardia. Her abdominal organs were completely mirrored, liver and gallbladder on the left, stomach and spleen on the right, while her heart remained in its usual position. It was only discovered after she donated her body to science. Situs inversus means the internal layout is flipped. In the more common form, situs inversus totalis, even the heart points to the right, dextrocardia. But in Bentley's case, the heart stayed left-sided while everything else reversed. The condition occurs in about 1 in 10,000 people. Most never experience symptoms unless emergency surgery or imaging is involved. Misdiagnoses can happen. For example, appendicitis pain shows on the left side instead of the right. In rare cases, situs inversus is part of Cartagena syndrome, which affects cilia and can lead to sinus infections or fertility issues. Bentley's case proved that sometimes the body just works differently and perfectly. Number 3. Giant congenital melanocytic nevus. Didier Montalvo from Colombia was born with a massive pigmented patch that blanketed most of his back like a shell. The diagnosis was a giant congenital melanocytic nevus, a rare birthmark that can grow thick, textured, and even sprout hair. Locals began calling him Turtle Boy, a nickname that weighed heavily on his confidence. Medical concerns surrounding giant nevi include the elevated risk of melanoma and the potential for neurocutaneous melanosis, a condition where pigmented cells develop in the brain or spinal cord. Doctors use MRI to screen for these before planning any surgery. Didier's treatment began when UK surgeon Neil Bulstrode traveled to Bogotá and teamed up with local specialists. The nevus was removed in stages, with skin grafts and tissue expansion used to rebuild his back. By the time he turned 6, Didier had begun healing, physically and emotionally. His story became a symbol of how rare conditions can be managed with compassion, planning, and international collaboration. Number 2. Anomalies. Shiloh Pepin captured global attention for living with a condition so rare that most infants with it don't survive more than a few days. She had anomalies, also called mermaid syndrome, a congenital disorder where the legs are fused and internal organs are severely underdeveloped. Shiloh's kidneys failed early in life, but she defied every prognosis. She underwent 2 kidney transplants, the last in 2007, and continued living well beyond medical expectations. She passed away at age 10 in October 2009 due to pneumonia. Anomalies is linked to abnormal blood vessel formation in the umbilical cord, where a single artery diverts blood away from the lower body, halting the development of the kidneys, bladder, and lungs. The condition appears in roughly 1 in 70,000 to 100,000 births. A few like Shiloh have survived infancy, like Tiffany Yorks, who lived to 27, and Milagros Cerrón in Peru, who had staged leg separations and lived to 15. Number 1. Cyclopia, single eye. In 2006, doctors in Chennai, India, delivered a baby that left the entire medical team stunned. She had 1 central eye and no nose. The condition is called cyclopia, the most extreme form of holoprosencephaly. In this condition, the front of the brain fails to divide properly. Since the brain controls facial development, the result is a single fused orbit. Cyclopia isn't just about 1 eye. It comes with major abnormalities in the brain and internal organs, which is why infants rarely live more than a few hours. In the Chennai case, the girl passed away shortly after birth and was recorded only as Baby of Gothi, without a name. To protect the family's privacy, doctors proposed 2 likely causes: a chromosomal defect like trisomy 13, or disruption of the sonic hedgehog pathway, a critical gene that guides midline facial and brain development. It's one of the rarest conditions in the world, seen in about 1 in 100,000 births. Some cases are detected by prenatal imaging. We hope you've enjoyed this video. If you did, please like, share, and subscribe. Thanks for hanging with us this far, and we'll see you soon in the next one.